WN Intelligent Conversation and Education, one of our great sponsors at the Lifebridge Sports Health Medicine Institute, and it's over at Foundry Row. I've been talking a lot about it. Last week, we did the concussion part of their program with Dr. Kevin Crutchfield. This week and every other week, we're going to be rotating in with the orthopedics. And Dr. Craig Bennett's been at this a long, long time, one of the founding members out there at Lifebridge at Foundry Row. And Doc, I know you and I've gotten to know each other. I almost came out there for a little elbow issue, but I feel like I'm healing up nicely on my own. But you're doing something very, very unique out in Owings Mills, and some folks may have seen Cal Ripken up on the billboards and whatnot. But on an every week basis, we're going to try to educate folks as to what you do there, because I know you've treated a lot of pro athletes, but what you're doing there really is about guys like me and weekend warriors and people with chronic injuries and problems they have that they don't have to go downtown anymore. You have a full-service facility right out in Owings Mills right now.
Yeah, we do. It's exciting. We've been open for just about a year now, and in terms of who we treat everyone. Anyone who wants to stay in motion, stay active, whether or not it's a recreational sport, high school sport, college sport. We enjoy helping folks stay as active as they can and get back onto the field or onto the court and do their thing, included. So.
Yeah, well, I know you were involved with the Terrapins. You've been involved in what we would call sports medicine, and of course your place, Lifebridge Health Sports Medicine Institute. Sports medicine's, it's so varied, so broad, and I think for the people in our world, in the sports terminology, we all hear about ACL and MCL, and I had chondromalacia in 2006, which is a little bit of probably for me being a catcher as a kid, but for orthopedics and for all that it entails in your world, it can be an elbow, it can be an arm, it can be a wrist, but from sports medicine and the kind of injuries you're seeing with high school athletes and college athletes, there's just so much more that goes into
it. Yeah, essentially, what we're doing is we're involved with musculoskeletal health. So when you talk about what separates sports medicine from the rest of orthopedics, it's really a sensitivity and an awareness of allowing people to get back to their activity. That activity can be a sport, but it can also be their job. It could be something that's just a part of their activities of daily living. And so really with sports, when I talk with my orthopedic colleagues, it's a heightened sensitivity to that clock, to that trying to get back at a certain level of time. So even though we talk about it as sports medicine, it's really musculoskeletal health for active people with a sensitivity to the time frames that they have in regards to getting back, and then following them after their injury, not just in their immediate recovery after a procedure, but the recovery for the rest of their life.
Well, I would say it's a life sentence. I mean, I had my knee worked on in 2006. I was told I wouldn't run again afterwards. I feel like I could run, but certainly I'm 50 now, and when it gets cold out, when the weather changes a little bit, my knee feels a little funny. Sometimes I wear shoes, my knee feels a little funny. But, Doc, I've been doing this, going on 4 decades now, talking to athletes about things and hearing about injuries and reporting as a reporter, and seeing a hockey player on crutches or a football player who's trying to get their foot back to full usage. And I had a conversation with Todd Heap a number of years ago, and it was fascinating for me because when I had my injury, I did not know what athletes go through for getting back on the field. Is it a 2-week injury, a 4-week injury? We always ask the coaches those kind of questions. But I think when you're just a sports writer or a sports commentator, the amount of things that I couldn't do back in the summer of 2006 that were normal, like getting on and off an airplane, getting in and out of a pool, getting in and out of bed, for the 8 to 10 to 12 weeks after that surgery, even 12 years later, you don't realize how much it's going to affect your life. But the rehab part of that, y'all think about the knife and you think about getting in the hospital and coming out and the stitches and all that. It's everything that happens after that I think your facility and any facility, the thing that makes me feel normal now is the rehab I had after that. And I don't think sports fans realize that, and I certainly was a sports fan. I didn't realize that until it happened to me,
Yeah, I mean, you said it. With many injuries, and as we get older, I would say it's fair to say almost all injuries, there's going to be some long-term adjustments that you have to consider. And that adjustment might be staying involved with the proper amount of stretching and doing some light weightlifting that we should do anyway, but generally speaking, many of us kind of get away from that if we don't have a problem or an injury. And so when you talk about recovery, it's a long-term process regardless of what the injury is. And the older you get, the more likely it is that it's a permanent either adjustment or a permanent focus on trying to make certain that body part stays limber and strong.
Dr. Craig Bennett is here. He is from Lifebridge Health, and they have the great sponsorship here of everything we're doing. And every week or every other week, we'll talk to Craig. We'll be talking to Dr. Kevin Crutchfield from the concussion and head trauma. We hear so much about sports and so many injuries. You can learn more about everything they're doing out of Lifebridge Health Sports Medicine Institute at Foundry Row. So if you've been out by the Wegmans, you're driving by what used to be the paper cup where my stepbrother worked 40 years ago, you now know the big full development that's going on. Out in the back, they're doing some amazing things out there, and Dr. Craig Bennett is part of all of that. You know, you went to medical school over 20 years ago. Are you amazed by where technology is? I mean, did you see all of this as a young man, that even in the NFL, people will be able to come back from these ACL, these injuries that used to really be devastating from an athlete standpoint? I marvel at how well athletes recover and the amount of technology that goes into sports medicine in the modern era.
Yeah, you know, I'm surprised occasionally, but no, I'm not amazed. I mean, we're similar in age, and you know, I didn't see a computer until I went to college. I didn't even know what a computer was until I got on campus. And now you think about the fact that, you know, your 4-year-old or your 3-year-old using a computer, and we all have computers in our phones, in our pockets. So the world is changing. Technology is amazing. So, you know, I'm not amazed by it. It's encouraging to see the things that we are able to do. And from an orthopedic surgeon standpoint, there are very few things that I do the same way now that I did them when I was training, 25 years ago. So we make adjustments, we add things, and even over a week-by-week or month-by-month basis, there are times when you make adjustments and you take advantage of the things that we now have at our disposal. The new technology has made it so much easier to do what we do, but it just feeds on itself. It never ends. The more you learn, the more you want to learn, the more you know, the more you want to know, and the better we get, the better we want to be.
You know, when people come in now, are they more educated or less educated as to what an ACL is? If they step the wrong way, you know, I've had friends recently, blow an ACL stepping off a curb the wrong way or whatever, right? But the terminology that goes into being specifically a football fan, I mean, baseball would be shoulder and Tommy John and ulnar nerves and, rotator cuffs and these terms that sports fans in my audience, and certainly in your world, you're a sports fan as well, that when a regular guy who's a golfer has an elbow or tennis elbow, all these things that are terms that a guy like me would use on the radio or use as a sports writer, when a regular Joe comes in with a Weekend Warrior issue, do they know more about it or think they know more about it, Doc?
It's a combination. There's no one answer that I'm going to give you. I will say that there are a series of things that I found are very, very important in regards to trying to take good care of folks from a musculoskeletal standpoint. One is to be honest with them. And another huge one is to understand that we have to manage expectations. So there's this tendency, and this has been increasing over the years as opposed to decreasing. There's a tendency to go on the internet and read and try to apply what you're reading to your personal situation. And there are so many factors that go into what the expectation should be that, generally speaking, people, and this includes my physician patients, people underestimate the very differences that are going to be based on your age, your activity level, your basic overall physical shape, your flexibility, your genetics, where you play, when you play, how you play, the time of year. I mean, there's so many factors. People want the answer. And coaches, a lot of times, they want the answer. You know, how long is it going to be, Doc? It's going to be when he's ready. Well, when's he going to be ready? Well, I've got to factor all those different things into my computer and into my brain. So managing expectations is probably the most difficult thing that I do now. And part of that difficulty is that people want to take small snippets of information and apply it to too many different aspects.
So in other words, Joe Flacco came back from an ACL in 6 months, so therefore I should be able to, right? And it doesn't work that way.
Correct.
Dr. Craig Bennett is here. Lifebridge Health Sports Medicine Institute is at Foundry Row in Owings Mills. The doc is going to be here answering my crazy questions every couple of weeks about orthopedic. You know, when you said the coaches want to know, certainly this week with Joe Flacco with the hip and all that, it's the buzz around town, and certainly that is part of the sports medicine thing that makes everyone sort of the couch coach, right? As to say, well, if he can come back from it, and how bad is his hip, and you deal with these kinds of things all the time, but every patient wants to know that, right? Like, when can I go back to work? When will I feel normal? Will I ever feel normal again, right?
Right. So again, one of the big things that we try to do, and I'm not saying that we are unique in this, but we try to make a focus of understanding the magnitude of it. Everybody's different. Every patient's different. Every injury has some subtle differences. And so it's a matter of taking the time and understanding where the person falls in the spectrum of things, and then following it week-by-week basis and providing individualized attention for whatever the injury is and whoever the person is.
I know you've been in a lot of places, and this is sort of a founding effort at Foundry Row with what you and Dr. Crutchfield, as well as everyone at Lifebridge, is trying to do out in Owings Mills. I was told what a unique facility it is. I've toured it. It feels unique to me because when I had my knee 15 years ago, you go downtown and you do it a certain way, but the hospital's moving out into the suburbs, but now these sort of, you call it an institute, a sports medicine institute, because there's everything's in one shop out there, and this is unique what you're doing.
Well, again, I'm focused on what we've got to do. I'm really not trying to compare us to others. I mean, it's one of those things where, for those of us who've got kids, you focus on what you've got to do. You got to do your thing. You got to do your thing correctly, and make sure you do everything you can to make certain you're upfront with people and being honest as you can and forward thinking. And I know that we're innovative, and so in terms of the uniqueness, I'm not going to speak to that. I'm just going to try to speak to the effort and hopefully the quality. And we try to provide everything that someone can need from the time they walk in the door until they feel they're appropriately rehabbed.
Appreciate you, Doc. Get back to fixing some patients. We'll check in with you a couple weeks from now. We'll continue to talk about some sports issues. Welcome to the team. I appreciate everything you guys are doing for us here at Lifebridge Health Sports Medicine Institute. If you are in need of any of their services, they're right out at Foundry Row in Owings Mills. Doc, have a great week. Keep fixing them.
Okay, great. You have a great week. Thank you.
We hope that Joe Flacco's fixed by the time we get to Dr. Craig Bennett again 2 weeks from now. You can find me out in the buy at Toyota.com Audio Vault 24 hours a day. We've talked about so many things here this week with the Orioles' new GM hiring and Mike Elias, as well as the Ravens and the Bengals this week, and the bye week, and the Terps getting onto the hardwood here, as well as the Caps and the Wizards. We're going everywhere. We are WNST.net, AM 1570, and WNST, Towson, Baltimore, and we never stop talking Baltimore sports.